Health Psychology News with Bill Moore.
Action. Hello everyone, this is Bill Moore, your roving reporter for Health Psychology Class 531. Today, I am on location in Newark, Ohio. Today's guest is Annmarie Thacker. She is a registered dietitian for Licking Memorial Hospital Community Case Management. Greetings, Ann. Thank you so much for being with us.
You're welcome.
Okay, well, most people, when they think of nutrition and cancer, they think that, they're concerned about healthy foods that are going to prevent cancer and those bad foods that may, cause cancer. But no one really thinks about once they get cancer. What are the nutritional needs of the cancer patient?
Right. Their nutritional needs can change dramatically. Their calorie and protein needs go up significantly. Many of them need a higher protein, higher calorie diet. When they start treatments, many of them have, side effects. So they may need a high fiber diet or a low fiber diet. Some of them have trouble, they might have sore mouth, or they might have problems with their stomach. And so we need to make modifications sometimes in their diets to help them. Some of them have trouble eating. They lose their appetite. We may have to, recommend supplements, for them. And chemotherapy can lower their white blood count. So there's actually a low white blood count diet that they follow if their white blood count gets too low. And we see many patients that are getting, radiation to the head and neck, and they may require, tube feedings. They eventually can't, eat by mouth. And we're consulted to even do assessments to make sure they're getting adequate calories and nutrients, and make recommendations for certain formulas to use through their tube feeding. And so they have a variety of different needs, and we really have to assess them individually.
Wow, thank you. Are there different diets for different cancers?
There's different diets. There's different modifications. Some depending on what area. May need more, have trouble. Maybe digesting certain things. They may need, like I said, a low fiber diet. Some need more fiber. Actually some of them have higher protein or calorie needs. And even for patients with diabetes, we don't want to be restricted with their diet. They may need just increases in their medications or insulin to help control or manage it better, but we don't want to restrict the diet. And our staff there tells them, even if they are overweight, they don't want them dieting, when they're, starting treatments. They need to get adequate calories and nutrients.
So now's not the time to go on that diet?
Not the time to try to lose weight when they're starting treatments.
Okay. Do you have any resources that you would recommend to cancer patients or the family members or caregivers to those patients?
Yeah, we have a lot of different resources and handouts we give them, but when they initially come in for an assessment, they actually fill out a form that goes to the American Cancer Society, and they have to fill out their name and all that information and tell what type of cancer they have, and they're provided with a lot of great resources, to get them started and to help them manage through their whole process.
That's great.
We have lots of handouts they give on adequate nutrition, whether they're having problems with anemia or fatigue or poor appetite, with medications. There's all kinds of supplements they get. If they need extra help, with social services, and they're evaluated to see if they need a dietitian consult. And so there's all kinds of resources out there, depending on what type of cancer, they'll get different resources.
Well, Ann, thank you very much for your time. I know
You're
you're a busy
welcome.
person. And that's all we have here on location. Back to you, Bill.